Hello, everyone, and welcome again to Brooklyn Law School's series of conversations on law in time of crisis. This conversation will be much more squarely about the public health crisis itself. I'm Michael Cahill. I'm the Dean of Brooklyn Law School, and I'm very pleased to be joined for this conversation by Professor Karen Porter on our faculty. Karen serves a dual role here at the law school in the faculty and the administration. As executive director of our Center for Health Science and Public Policy and teaching public health law, which, as is obvious, is relevant to today's conversation. And also as our inaugural Associate Dean for Inclusion and Diversity here at the law school, a position she has held since this January. We will be primarily talking about Karen's expertise in that first capacity, but I think the conversation will touch as well on her new administrative role. So let's dive in. Karen, as I noted, you teach public health law here at the law school. Maybe you can give us a little bit of a background on some of the issues that you discuss in that course, and before thinking about the impact of the pandemic specifically, some of the ways in which you discuss the strengths and shortcomings of our current public health law system.
Thank you, Michael. I'm happy to do that. So I do teach a course here on public health law, and it's a course that basically takes up the issue of the role of government, the source of government's power, and that power in relationship to individual rights. And so a lot of the course actually covers most of constitutional law. It also covers issues related to the states, right? Police power and the source of power for state authority. Fundamentally, it covers issues related to federalism, right? I mean, that is, I think, the central issue for most of public health as it relates to the law. We do cover topics that range in breadth from contagious disease kinds of issues to executive authority to things like emergency powers on the part of government or just emergency response overall.
So it's a pretty complicated and intricate legal framework governing public health issues. What are the flaws or issues or inadequacies that this current pandemic have exposed in that legal framework that you're describing?
So I think that the flaws with our system overall are not so much singularly exposed by the COVID-19 as much as they have been consistently exposed by many of the challenges presented by public health. And that really is our federal system, right, of government. Many of the questions are about who's in charge, right? And what authority does that entity have? And so the fact that we exist in a federal system where there's dual power, both on the part of the federal government and the states, creates, enormous confusion at times about who has the power to do what and how far they can go, right, with that power. So that is, I think the most challenging piece related to public health law.
We've heard a lot from and seen a lot of public health experts in the current crisis, and their role and their relevance is fairly obvious. But you're someone who sort of bridges the world of public health and obviously the world of law and lawyers. What are the things that we as lawyers, given our particular training and expertise, can bring to the table in a situation like this?
So I think we have heard a lot from public health officials. We haven't heard as much with regard to the work that lawyers are doing within this field. And I do think that there's quite a bit of work behind the scenes from the legal community, much of that around basically how lawyers are working with the state or with the federal government in order to sort of figure out what's possible. So we've seen on the federal level a lot of announcements of potential activity, national, stay-at-home order, things of that sort. And we've seen things like that announced and then not necessarily come to fruition. I would suggest to you that part of why those things are not coming to fruition are largely because there are lawyers working behind the scene to determine what the law is, like what the law allows in terms of being able to actually implement those kinds of activities or not. Just this past week, we saw the state Supreme Court in Wisconsin prohibit any further activity with regard to restrictions on the part of citizens in terms of stay-at-home orders and mask wearing and things of that sort. The court basically decided that the governor had overstepped, right, his authority in that regard. And it's basically in the last 4 days left Wisconsin without any regulations in place. It's the only state in the country right today that has no provisions in place, largely determined by the courts. So we're seeing lawyers at work, right, thinking about these thorny issues about the state's authority and the rights of individuals. I also have to say, I think we're seeing at the level of sort of sorting out issues related to the economy, to the disruption of businesses. There's so many issues that are coming about in terms of just how businesses are surviving, planning for reorganization, planning, sort of with regard to just recovery, right, of the economy, sort of overall. And then I think in terms of individual rights, we're seeing a lot of lawyers work on the level of just helping individuals with the kinds of problems that have developed for them. Sometimes those are in the healthcare context. Access to services, for example, in Texas, in early April, one of the things that they did in restricting access to non-essential medical care, was basically to prohibit abortions, right? And so we saw a response on the part of the legal community to try to help navigate that issue.
Well, if we can think about history and how this current crisis situation might relate to other examples that we've seen, obviously it is in some ways unprecedented in size and scope, but at the same time, not the first public health crisis we've witnessed or had to react to. And having served as a senior policy analyst and staff counsel for the National Commission on AIDS, maybe you can talk a bit about how this current situation compares to that and what lessons we might have learned from past health crises such as the AIDS crisis to apply to the current situation.
Well, I think that there are similarities and differences. Some of the similarities are just with regard to any kind of novel disease that would confront a government agency of any kind. And so both HIV, AIDS, and the coronavirus are novel problems, right? Things that there was not much experience with before. So real questions sort of come about with regard to whether the law that we have in place is adequate to meet the demands. And I think in most cases, the answer to that is yes and no, right? Even with the law, and even with having, I think, a very good framework, what we have is a framework that has either been neglected in the sense that it has not been used for a very long period of time, or that it has not been sort of challenged in the sense of put to use in a way that would help us understand whether it's going to work as well as we think that we would like it to.
Any particular examples in the HIV/AIDS situation or other situations in terms of the federalism issues you described, and whether there were good collaborations or cooperation between the federal and state and local levels in that situation, or maybe examples of what not to do?
Again, the issues with regard to federalism, I think, were less problematic within the context of HIV in the initial response. There were a lot of concerns initially about what the role of the federal government would be. The commission that I served on was a congressional commission whose mandate specifically was to actually sort out what the role of the federal government was with respect to the HIV epidemic. And because most of what was needed there was not so much related to the spread of disease in the way that we're seeing it with COVID-19, where, because it is an airborne disease or can be communicated efficiently through the air, issues like quarantine and all of those things are much more relevant today. They were raised as issues with regard to HIV, but were not supported by the scientific community based on how AIDS was transmitted. So we did see states taking the lead in terms of sorting out kind of how to respond, what sort of interventions would be put in place. Where we saw, I think, much more activity on the federal level was with regard to the development of treatments and other therapies.
To change gears a little bit, I mentioned at the outset that you are not only a professor on our faculty, but now serve as Associate Dean for Inclusion and Diversity. And you were able to settle into that role for all of about 2 months before the global pandemic hit us. I wonder if you can say a few things about what you've observed about the impact of COVID-19 on your own role and some of the issues that you've witnessed.
I think, like every educational institution in the country, whether it is at the level of secondary education or higher education, we've really seen just a stark exposure of inequities, right, within our society. The forced transition to online learning has, I think, really exposed just the challenges that we have before us in terms of ensuring that people have access to the education that they are entitled to. And in order to have that access, to be able to have access to basic resources that allow that to take place. And that's sort of where a lot of work really needs to be done. The physical plant of the law school has turned out for all of us to be something that we have not, I think, really sort of focused that much on in the past in terms of how essential it is to functioning and to sort of interactions. So even in a context in which we can imagine continued use of online resources, there needs to be sort of, I think, really focused attention paid to the kind of experiences and issues with regard to equity that just the physical plant of the law school provide, right, for many students. And so I think that's a challenge for all of us, is to actually sort of sort through those issues and see how we can work to help students have the access that they need.
Certainly no shortage of issues for us to confront and address in the upcoming months. Some of them institutional, as you suggest, some of them also, as you note, individual to a number of our students. And there will be an ongoing challenge that I'm pleased to say our alumni and others have been helping us meet by supporting our Student Support Fund, which provides direct financial assistance to students who need it, whether by virtue of health needs or some of the other ancillary economic issues that have arisen by virtue of this crisis. Certainly plenty for us to grapple with, and very pleased, both in terms of health and in terms of inclusion and diversity, that we have you here to help us grapple with those things. Many thanks to Karen Porter for this conversation today, and be on the lookout for further conversations in our series about law in time of crisis. Thank you very much.
Thank you, Michael.